Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with a November 19th, 2020 update from the Dubuque County Public Health Incident Management Team. Dubuque County's COVID-19 case total continues to climb with almost 8,300 cases reported and an average positivity rate of almost 23%, which means about 1 in 4 individuals have tested positive for COVID-19. Another very sad outcome is that we continue to experience deaths of Dubuque County residents due to COVID-19, with a total of 88 during this pandemic. That's 12 more since my update on November 12th. In the last 7 days, we've had over 600 cases in Dubuque County and 22,000 in the state. The Iowa Department of Public Health cases are happening among all age groups and from all kinds of settings, but in particular, spread is happening at smaller indoor social and other gatherings. The hospitals continue to have higher numbers of COVID-19 patients, and this is going to continue based on the past few weeks of surging cases. You see, hospitalizations, and deaths for that matter, are lagging indicators, meaning they happen days or weeks after symptoms develop. So a person who tests positive today may not end up being hospitalized for up to 2 to 3 weeks. And also, some people stay in the hospital for a few days, and unfortunately, some may be there for weeks. This is sadly all caused by more community spread. In other words, right now it's fair to say that every person infected will pass it to at least one other person. This is predicted by our days to double number of 42. Meaning that on December 31st of this year, we will have over 16,500 cases in Dubuque County. That's 8,992 new cases between now and then. Think about that as you contemplate Thanksgiving and Black Friday plans. We have a long holiday weekend next week. Please keep your gatherings small and among those without risk to becoming seriously ill with COVID-19. This is so hard for grandparents, aunts, uncles, adult children, and friends who are elderly or who have underlying health conditions like diabetes, cancer, lung and heart problems, obesity, even pregnancy. All of these should be considered when thinking about going to gatherings or out in the community in the coming weeks. We don't want to add to those hospitalization numbers. We don't want to have to open an alternate care site. Even besides holidays, keeping your socializing with others to minimal numbers is important. I won't even be celebrating my sister's birthday with her today. But happy birthday anyway, Colleen. This week, Governor Reynolds came out with a new proclamation and then a further clarification with additional requirements for gatherings and requiring distancing and mask wearing in certain situations and with specified numbers of people. It's rather lengthy and too complex for me to review here today. But here's the bottom line. Don't worry about the specific limitations for numbers in the enhanced public health guidelines. The best way to make sure you're both following the rules of the proclamation and being as safe as possible is to physical distance with a minimum of 6 feet between others, as well as consistently and correctly wearing a mask or approved face covering. And keep your indoor gatherings to under 15 people. And for private in-home gatherings, we should limit the number of people from outside our households well below that 15. In the first place, most of us don't have homes with spaces big enough to social distance 6 feet between very many people at all. Keep in mind the probability of someone having COVID-19 for a gathering of 10 people in Dubuque County right now is 55%. Yes, there's a 55% chance of someone having COVID-19 with a group of 10 people. Looking ahead to next week, test sites will operate as normal, except on Thursday, Thanksgiving Day, and it may take a little longer to get results due to the holiday. But regardless of whether or not you're tested or can get a COVID-19 test, if you're having symptoms, you should stay home and isolate for at least 10 days. And if you've been exposed to someone with COVID-19 but don't yet have symptoms, you should stay home for quarantine for 14 days. It's up to all of us to make the current situation better. We know what to do. Now let's do it. So now more than ever, America needs public health. For years, we've been taken for granted. handling outbreaks, epidemics, and initiating health policy to keep us all healthy and prevent illness and chronic disease. Whether it's safe drinking water, clean air, or the ability to combat disease, our work and messaging is consistent and often simple, just like it is for COVID-19. Prevention is the key, and it takes some effort, but even as simple as hand washing and staying home when you're sick. So enter the holiday season armed with public health backing you up. And don't add to this rampant spread of COVID-19 because we're all in this together.